This Thanksgiving, many who have loved ones in long-term care facilities will not be able to celebrate with them. This year, those facilities are grappling with a surge of COVID-19 cases and deaths. ETSU professor Ryan Youngblood knows the nursing home industry. A full 3 months ago, the former administrator told digital reporter Jeff Keeling that he was saddened by the terrible hand the industry was being dealt by the virus.
My heart goes out to him because it's such a difficult position to be put in. You know, day in and day out, not knowing when I come into this facility, am I going to be the carrier, or am I going to witness someone that I care about, pass on because of something I did or someone around me did? I wouldn't want to be in that situation.
Tough times for sure. Jeff's been following nursing home and all COVID trends really since August. Let's compare August to now. What was it like then, and what are we seeing now in terms of COVID and long-term care?
Yeah, and first, really, I just want to offer my condolences, heartfelt, to all the families who have lost loved ones in long-term care facilities, and certainly my respect for those who are working in those. It is a very tough haul for everybody. But we had 323 resident cases when we talked in the 7 counties of Northeast Tennessee, and we surpassed that by a long shot. If you'll pull up graphic number 1 here, it shows a weekly total of residents in long-term care facilities in Northeast Tennessee who have COVID. So that's a cumulative total, and you see on the left of that screen how it went up pretty sharply for about 4 weeks, and then it leveled off until about mid-October. But boy, since the report of October 23rd, we've been averaging over 90 new resident cases each week, and the deaths have followed as well. And there were 33 deaths when we talked. That was half of the total in our region.
In August.
In August, and there are 160 that have been reported now.
Wow. You've been following reporting that shows about 40% of deaths in the U.S. were attributed to COVID-19 in long-term care. How does that compare to here?
That compares to here unfavorably for us, sadly. We have in the region 46%, if you'll pull up graphic number 2, 46% of the deaths in the region, 240 out of 524, were from long-term care facilities. That was as of the last report of both states, Virginia and Tennessee. And if you look at Virginia, more than half, 54% of their deaths have been from long-term care. They had a major outbreak that was reported there last week in Wise County, and that is contributing to that. But the numbers are not pretty, and you see that's large numbers of people, lots of families being affected.
How does this work when an outbreak happens? Is this a period of a few weeks? How long does it take before this is over, Jeff?
Some of these facilities, if you'll pull up the 3rd graphic, some of them have had this run through fairly quickly, and then they get out of the woods and it's over. But if you look at this graphic right here, we heard from Ballad Health just yesterday, I believe it was, that there was an outbreak at Wexford House. Well, that outbreak actually was first reported September 11th. And if you look at these numbers, the blue represents residents, the orange represents staff. For weeks, it just kind of plugged along, and they seem to have it fairly well under control. And then you look at last week's report, and suddenly it's shot up to 56 residents from 17 and to 33 staff from 9. So that's just the way it can be in there. It's very tough to get rid of.
How about the extent of the outbreaks as compared to population? Because, that's another big important factor of understanding perspective here.
Right. Well, and if you'll pull up the last graphic, we'll see here that in Tennessee, in Northeast Tennessee, we represent 7.5% of the population, but unfortunately we're punching above our weight when it comes to long-term care impact. Almost 13% of the cases have been here, 13.4% of resident deaths have been here, and 10% of the staff cases. So sadly, the outbreaks seem to be having a harder impact here than they are statewide.
A very visible indication of how serious this is in those long-term facilities for Thanksgiving. Jeff, you've talked to a lot of people, a lot of data. We know it's in a full report that you're posting on WJHL.com. Thank you for your ongoing work to track COVID-19. We appreciate it.
Thank you, Josh.
Well,